government?
Well, naturally, we're very concerned, and our thoughts and prayers are with the families of all those who've lost loved ones in the last few days. And today's figures remind us how important it is to maintain the social distancing rules that the government have announced. It's absolutely critical that all of us stay at home, that we limit our trips away from home to just one a day for exercise. We limit the amount that we shop. If we do that, we can all play our part in helping the NHS.
I mean, it's hard, of course, to know how long this is going to go on for, but what's the government's working assumption for when the peak is likely to be?
Well, we're doing everything we can at the moment to try to protect the NHS by limiting the spread of the virus. And of course, there are different models, as you will know, produced by academics, but we follow the best scientific advice, and that advice is for all of us, if we possibly can, to maintain those social distancing rules, because if we do so, then we can flatten the curve, we can delay the onset of the peak, and then we can make sure that our NHS, which is becoming more resilient by the day, is better equipped to cope.
I can understand, you not wanting to commit to exactly when you think the peak is going to be, but it does feel like we're wrestling with, as you acknowledge, some wildly different projections. Imperial, for example, one Imperial study estimating only 5,700 people could lose their lives. A different paper said that without social distancing, it could be 260,000. Yesterday, the medical director of the NHS saying that it would be a good result for the United Kingdom if the death toll was kept below 20,000. I mean, can you just tell us a bit about what the reality is and what the assumptions are that the government is working to?
Yes, well, the first thing to say is that every death is a tragedy for those involved, and we want to absolutely minimise the number of people who die, and we want to make sure that the NHS is in the strongest possible position to deal with the enormous public health challenge that we all face. On Friday, I mentioned at the press conference that the rate of infection was doubling at between 3 to 4 days. Now, that was obviously a reflection of the latest figures as a result of the social distancing measures that the government has implemented. We hope that we can reduce the rate of infection. But at this stage, we just need to make sure that everyone observes those rules, because, again, in a challenging situation like this, all of us have our part to play, and the way in which everyone watching can play their part is, as so many, as the overwhelming majority of people have done, is to follow rigidly the rules that have been outlined.
The Prime Minister today has written to every household. It's a pretty bleak message in some ways, saying that things will get worse before they get better, urging people to follow the rules as you've been laying out this morning. He also said he won't hesitate to go further if necessary. What further levers could the government pull?
Well, we want to do everything we can, both to reduce the spread of the disease, but also to support the NHS. And it's always the case that government stands ready, if necessary, to do what it takes in order to reduce the spread of infection. At the moment, all the evidence is that people are observing the rules. If you look at the number of people on public transport, that has fallen. If you look at footfall in supermarkets and other stores, that has fallen as well. All the evidence is that people, in a public-spirited, generous fashion, are displaying sort of solidarity with the NHS and with other frontline workers that we would want to see. But of course, we keep things under review in order to ensure that if there are further steps, they can be implemented. But what we have sought to do is to make sure that we implement the right steps at the right time, following appropriate scientific advice.
The question was about what the further levers could be. So what are the further options that you're talking about, that the Prime Minister's talking about? I mean, people really want straight answers.
Yes, and I think we can take further steps, but it's important that when we're thinking about something as serious as this, when we want to make sure that we have the right steps in place, that we're influencing people's behaviour in the right way, that we are keeping people safe, that we don't preempt discussion of what other steps may be required. But the Prime Minister, the whole government, we follow the advice that comes from our scientific advisors, from our medical advisors, and if there are appropriate steps that they recommend that we take, then we will take them. But it doesn't help those advisors, it doesn't help our preparations if we preempt them before we need to.
Balancing act, but at the same time, you're asking people to make extraordinary changes to their lives. People are worried when they're looking at the figures that come out on a daily basis showing the death toll ticking up. you won't tell us what the scientific advice is, what the working assumptions are. You won't tell us what the further steps are that the government is prepared to take. Is there any direction that you can give us on how long the lockdown, for example, could last?
Well, at the moment, it is the case that, as you say, people are making enormous sacrifices. They are showing the sort of public spiritedness, the selflessness that is inspiring. And the best advice at the moment is for people to observe the current guidelines. And we hope that that can flatten the curve. Certainly, all the evidence is that people, by observing those guidelines, are contributing to reducing the spread of infection. But it's also important to say that the scientific models are out there. People have had a chance to look and to examine them. There is a range, as people will know, of potential outcomes, but those outcomes are not predetermined. Our behaviour can influence those outcomes, and if all of us practice safe social distancing, if all of us stay at home, then the number of people who are being infected reduces, the resilience of the NHS can grow, the NHS can become better equipped to deal with this situation.
The question was about how long the lockdown could last for. I'm still not really that clear. Professor Neil Ferguson of Imperial, one of the advisors, of course, the government's following very closely, has said that he expects the lockdown to last until early June. Is that a fair expectation?
Well, as I say, there are different projections as to how long the lockdown might last, but it's not the case that the length of the lockdown is something that is absolutely fixed. It depends on all of our behaviour. We can, if we follow the guidelines, we can deal more effectively with the spread of the disease. The models are projections. And of course, we adjust our action on the basis of behaviour, on the basis of data, on the basis of facts, on the basis of science. But people should, as the Prime Minister's letter today absolutely underlines and recognise, that the situation will get worse before it gets better, and that is why it is so important that all of us play our part. It's also why it's so inspiring that those leading the NHS have been able to increase capacity, increase the number of beds available, and ensure that we can be in a better position to deal with the increased level of infection and indeed the increased level of mortality that is coming.
Talking about the NHS in particular, the government announced this week that they're going to be rolling out testing for the NHS workers who, of course, really are on the front line on the fight against this virus. So when is it going to happen, and why has it taken so long for the government to get to this point? Well,
we have been increasing the number of tests, and I can confirm today that the number of tests being carried out has hit 10,000 now, and we want to increase that, 10,000 a day. We want to increase that to 25,000 a day. And just last week, just Friday, the Prime Minister authorised a new programme of testing, so working with research institutes and also with companies like Boots. We're now in a position to be able to test more. Boots have opened drive-in testing centres. We're increasing the number of people being tested all the time. And of course, it's NHS and social care frontline workers who are first in line for those new tests.
So when are we going to see a full rollout then for all health, social care and other frontline workers as you describe it?
That is the ambition. We want to make sure that we can test, test and test again, because of course if we are able to test, not only do we have a better picture of the spread of infection, it's also the case that people who at the moment are self-isolating because members of their family have symptoms, if we can test and we know that they are negative, then we can get them to join the front line. And of course it also critically protects the health of people at the front line who are working so incredibly hard at the moment and whom it is all our duty to support.
So what's the time frame then? When will all NHS workers, all social care workers get tested?
Well, we've increased, as I say, the number of tests to 10,000 a day. We're going to move to get that up to 25,000 a day, and we're doing all that we can to increase and to accelerate that. And I hope that we will be able to test as many frontline workers at the earliest possible stage. We've been working, as I say, with scientists, with the big players in providing medical supplies and drugs like Boots and others in order to increase the number of tests that we have. And the UK has been one of those countries which has been testing proportionately a larger section of its population than some other countries, but there is more to do, much more to do.
So it doesn't sound like you can tell me when the full rollout will be. Many will be wondering why it has taken so long. 2 weeks ago today, the chair of the British Medical Association, Dr. Chan Nagpal, was on this programme saying about how important it was to get testing for NHS staff. I can't emphasise how serious the problem is. We don't have the luxury of time anymore. Why is it that 2 weeks on, you still can't tell us when all NHS staff are going to get tested?
Well, we are increasing the number of tests, and that's why so much effort and energy has been directed by scientists and by others in order to increase the number of tests that take place. As I say, 10,000 people being tested today. That is a significant increase over where we were last week, and that number is going to be increasing all the time.
The other part of the fight on the NHS, of course, is the number of ventilators, the number of intensive care beds. And I know that the government's been trying to kind of ramp up the availability of both of those things. You started, I think, from a position of having 5,000 ventilators. So how many ventilators and how many intensive care beds are now available?
Well, we have available to the NHS now just over 8,000 ventilators. That's because we've repurposed some of the intensive care capacity that we have in the NHS. It's also the case that Simon Stevens, the Chief Executive of the NHS, has done a deal with the private sector in order to increase ventilator capacity available to the NHS. And we are going to get another 8,000 or so ventilators, including some which have been sourced from abroad, which are coming here from other countries. And of course, we're increasing our capacity to manufacture ventilators in the UK. As you'll be aware, we've done a deal with Dyson, which means that provided all the appropriate tests are passed, we can have an additional 10,000 ventilators from that source alone. And there are other companies, from McLaren to Rolls-Royce and others, who are changing the way in which they manufacture in order to join in the national effort to increase the ventilator capacity available. When it comes to beds, Simon Stevens, again the Chief Executive of the NHS, outlined on Friday that as a result of cancelling the non-essential work in the NHS, and also as a result of the decision to open a new hospital in East London, NHS Nightingale, we've managed to release the equivalent of 50 hospitals worth of new beds to deal with COVID-19 patients.
OK. Now, the Prime Minister and the Health Secretary have both tested positive for coronavirus this week. The Chief Medical Officer is also self-isolating with symptoms of the virus. So there are going to be people who are genuinely very worried about what this means for the UK's response to COVID-19. So who is currently in charge? And if the Prime Minister's condition worsens, who will take over?
Well, the Prime Minister is in charge. On Friday morning, he chaired the meeting that brings all the effort of government together with ministers, officials, scientists and doctors. And he did so from his study in Downing Street using modern technology. We had a video conference and the Prime Minister was in charge. He was the person who was driving forward our efforts on testing, making sure that we increase the number of tests available. He was the person who was interrogating the forward supply of ventilators in order to make sure that we had the capacity required. He was the person who was overseeing our support for frontline workers in other areas, in food production and so on, in order to make sure that the life of the nation can continue. So he is very firmly in charge, and later this afternoon, the Prime Minister will also be hosting another meeting by video conference with the relevant ministers and officials.
Who will take charge if the Prime Minister's condition worsens? It's a really straight question.
Well, the Prime Minister is in charge at the moment, and
over if his condition worsens.
I was just answering the question. The designated deputy to the Prime Minister is the First Secretary of State, Dominic Raab.
We will make America great again.